At 8:42 on the morning of September 7, 1854, Dr. John Snow walked past 6 bodies laid out on the cobblestones of Broad Street. The sun had barely risen over London, but the death count had already reached 17. By nightfall, it would be 70. The stench of decay and human waste hung in the air like a fog. Snow was 41 years old, a physician with an obsession that had made him a laughingstock among his peers. For 8 years, he'd been arguing that cholera spread through contaminated water. His colleagues called it absurd. They believed in miasma, poisonous air rising from filth. They had degrees from Cambridge and Oxford. Snow had apprenticed with a coal miner's surgeon. They laughed at his water theory. They dismissed his maps and data. But on this September morning, with bodies piling up in the heart of Soho, Snow carried a notebook, a pen, and a theory that would either save thousands or prove him a fool. The outbreak had begun 3 days earlier. Sarah Lewis, a tailor's wife living at 40 Broad Street, washed her baby's soiled diaper in a bucket of water and dumped it into the cesspool in the basement of her building. The baby died that night. By morning, 2 families on the ground floor were vomiting and convulsing. Their skin turned blue-gray from dehydration. They called it the King's Blue. By afternoon, the disease had spread to the family upstairs. 3 more buildings reported cases. The pattern was rapid, brutal, and seemingly random. A policeman who walked the Broad Street beat every day remained healthy. His neighbor, who rarely left his home, died within 12 hours of symptoms appearing. London's medical establishment had an explanation. The summer heat had stirred up noxious vapors from the sewers. The air itself was poisonous. Breathe it long enough and you'd contract cholera. The Board of Health's chief advisor, Edwin Chadwick, was certain. He had data, crude death maps showing cholera clustered in the poorest, filthiest neighborhoods. The solution was obvious: clean the streets, burn sulfur, improve ventilation. Chadwick's sanitation reforms had already saved thousands from typhoid and tuberculosis. He was a hero of public health, and he was completely wrong about cholera. Snow had spent years studying the disease. In 1849, during the last major outbreak, he'd documented case after case in South London. He'd tracked water supplies, mapped deaths, analyzed the timing of symptoms. The pattern was clear to him. Cholera didn't spread through air. It spread through water contaminated with the cholera poison, microscopic particles, invisible to the eye, that multiplied in the human intestine and were expelled in diarrhea. Drink water tainted with these particles, and you'd be infected within hours. The theory was elegant, logical, and completely at odds with mainstream medical belief. The problem was proof. How do you prove an invisible pathogen exists? Microscopes in 1854 couldn't reveal bacteria clearly. Germ theory wouldn't be accepted for another 20 years. Snow needed circumstantial evidence so overwhelming that even the most skeptical physician would have to acknowledge it. The Broad Street outbreak gave him that chance. On September 8th, Snow began his investigation. He walked door to door through the infected area, a 10-block radius centered on the intersection of Broad Street and Cambridge Street. He knocked on doors. He asked questions. Where did you get your water? When did the symptoms start? Who in your household is sick? Who died? The residents, terrified and grieving, let him in. Some thought he was a government inspector. Others recognized him as the physician who'd chloroformed Queen Victoria during the birth of Prince Leopold 2 years earlier. That gave him credibility. He recorded everything in his notebook: numbers, names, ages, occupations, sources of water. At number 40, where Sarah Lewis's baby had died first, he learned that 5 residents had perished. The basement cesspool was just 3 feet from the building's water source. At the Lion Brewery on Broad Street, 70 workers remained healthy despite being surrounded by cases. Snow interviewed the foreman. The brewery had its own deep well. Workers drank beer, not water from the street pump. Not one fell ill. By September 10th, Snow had documented 83 deaths. He plotted them on a map of Soho, using black bars to mark each fatality. The pattern emerged immediately. The deaths clustered around one specific point, the public water pump on Broad Street. The pump sat at the corner, a cast-iron fixture where residents filled their buckets every morning. It drew from a shallow well sunk just 30 feet into London's clay. The water was clear, cold, and by all appearances pure. Snow tested the water himself. He filled a glass and examined it. No visible contamination, no unusual smell. He boiled a sample and looked for sediment. Nothing conclusive. Under his microscope, he saw white flocculent particles, organic matter, but couldn't identify them. The evidence was indirect. The deaths formed a near-perfect circle around the pump. Families living closer to other pumps remained healthy. A woman in Hampstead, 3 miles away, had died, but her son revealed she'd had a servant bring her water from the Broad Street pump because she preferred its taste. A workhouse with 535 inmates, located just 2 blocks away, had only 5 deaths. They had their own well. The data was damning. But Snow faced a problem. The Board of Guardians of St. James Parish, the local government body responsible for public health, met on September 14th. They would not act on a theory. They needed physical evidence. Snow needed to show them contamination. He descended into the basement of 40 Broad Street with an engineer named Edmund Cooper. The cesspool was brick-lined, crumbling, and filled with sewage. Cooper measured the distance to the well that fed the Broad Street pump, 29 feet. London regulations required a minimum separation of 30 feet. The cesspool's bricks were decayed. Sewage was seeping directly into the groundwater. On the evening of September 7th, 3 days after the outbreak began, Snow presented his findings to the Board of Guardians. He brought his map. He brought his case records. He explained his water theory. The room was skeptical. Cholera had been devastating London for decades. The medical establishment had consensus. Miasma, bad air. How could one pump cause this? Snow pointed to the data. 500 deaths in 10 days, almost all within a few hundred yards of one pump. Families with their own wells were spared. The Lion Brewery workers were spared. The evidence was circumstantial, yes, but it was overwhelming. The board debated for 2 hours. Some members argued for waiting. Perhaps the outbreak would subside on its own, as these things often did. Others worried about the cost of replacing the pump. One physician on the board sided with Snow, not because he believed the water theory, but because removing the pump couldn't hurt. If Snow was wrong, they'd wasted minimal resources. If he was right, they'd save lives. At 10:35 p.m., the board voted. The pump handle would be removed the next morning. It was a compromise, not a full endorsement of Snow's theory, but action nonetheless. At dawn on September 8th, workers arrived at Broad Street with tools and dismantled the pump's wooden handle. Residents protested. They'd used this pump for generations. Where would they get water now? The board directed them to pumps 3 blocks away. Some complied. Others lowered buckets on ropes into the well, circumventing the missing handle. By September 10th, new cases had slowed to a trickle. By September 15th, the outbreak was effectively over. 578 people had died in the immediate area. More than 10,000 had fled, terrified, abandoning homes and businesses. The Soho neighborhood was decimated, and the argument over what had caused it was just beginning. The medical establishment remained unconvinced. Removing the pump had coincided with the outbreak's end. Yes, but correlation wasn't causation. Cholera outbreaks always burned themselves out after a few weeks. Perhaps this one had simply run its course. Edwin Chadwick published a rebuttal to Snow's theory, arguing that the miasma in Soho had dissipated naturally. Other physicians suggested that panic had driven people away, reducing the population density and breaking the chain of infection through air. Snow's map was impressive, they admitted. His data collection was meticulous, but his conclusion was speculative. Snow knew he needed more. In the months following the outbreak, he expanded his investigation. He examined mortality records across all of London. He discovered something extraordinary. 2 private water companies served the city, the Lambeth Company and the Southwark and Vauxhall Company. In 1849, both companies had drawn water from the Thames at points contaminated by sewage. In 1852, Lambeth moved its intake upstream to a cleaner section of the river. Southwark and Vauxhall did not. The service areas overlapped. Houses on the same street, sometimes next door to each other, received water from different companies. Snow obtained death records for the next cholera outbreak in 1854. He cross-referenced them with customer lists from both companies. The results were staggering. Households supplied by Southwark and Vauxhall, still drawing from sewage-contaminated water, had a cholera death rate 14 times higher than those supplied by Lambeth. Same neighborhoods, same air quality, same socioeconomic conditions. The only variable was the water source. It was natural experiment on a massive scale, and the data was irrefutable. He published his findings in 1855 in a book titled On the Mode of Communication of Cholera. The medical community still resisted. The idea that an invisible pathogen could live in water, survive in the gut, and spread through fecal contamination was too radical. It required a complete reimagining of disease transmission. It challenged decades of medical dogma, and it had come from a man without a university degree, a provincial physician with no standing in London's elite medical societies. But the evidence accumulated. Other physicians began replicating Snow's methods. They mapped cholera cases. They traced water supplies. The patterns held. In Hamburg, in Paris, in New York, wherever cholera struck, contaminated water was the culprit. By the 1860s, cities across Europe began improving their water infrastructure. Separate systems for drinking water and sewage disposal, filtration, chlorination. The changes were expensive, politically contentious, and slow to implement, but they worked. Snow died in 1858, 4 years after the Broad Street outbreak. He was 55. The cause was a stroke, possibly brought on by years of overwork. He never lived to see his theory fully vindicated. He never saw the discovery of Vibrio cholerae, the bacterium responsible for cholera, under a microscope. He never knew that his method, mapping disease, tracing sources, using data to challenge assumptions, would become the foundation of modern epidemiology. The Broad Street pump was restored after the outbreak ended. The handle was reattached. Residents used it for decades. In 1992, the building that had housed the pump was demolished and rebuilt as a pub. The pub is called the John Snow. A replica of the pump stands outside as a memorial. A granite curbstone marks the original location. Every year, epidemiologists and public health officials make pilgrimages there, paying respects to the man who proved that lives could be saved, not by grand theories or expensive treatments, but by asking the right questions and following the data wherever it led. The legacy of Snow's work extends far beyond cholera. His map, those black bars clustered around the pump, became the template for disease tracking worldwide. During the 2003 SARS outbreak, health officials used similar mapping to identify transmission clusters. During COVID-19, contact tracing and outbreak mapping relied on principles Snow established. The simple act of visualizing data geographically, of looking for patterns in mortality, transformed how we understand and combat infectious disease. There's an irony to Snow's story. He saved tens of thousands of lives, perhaps millions over the decades that followed, by convincing authorities to remove a pump handle. The action itself was almost trivial, a piece of wood dismantled in minutes. But the intellectual work behind it was monumental. It required observing, documenting, mapping, questioning, and persisting in the face of ridicule. It required believing that data could reveal truth even when that truth contradicted accepted wisdom. The Broad Street outbreak killed 578 people in 10 days, but it also proved that epidemics could be stopped, not by praying for divine intervention, not by waiting for them to burn out, but by understanding their mechanisms and cutting off their source. Snow's map showed that diseases have causes, that those causes can be identified, and that intervention is possible. That realization fundamentally changed medicine. It made public health a science rather than a guessing game. Today, when health officials respond to an outbreak, whether it's E. coli in lettuce, lead in drinking water, or a novel virus spreading through a community, they follow Snow's playbook. Map the cases, trace the connections, identify the source, take action based on evidence. It seems obvious now. In 1854, it was revolutionary. Snow's sewer map, as his critics called it, was more than a visual aid. It was proof that the invisible could be made visible through careful observation. It demonstrated that patterns exist even in apparent chaos. It showed that one person, armed with logic and determination, could challenge an entire establishment and be proven right. That's a legacy worth commemorating. Not just in pubs and granite curbstones, but in every life saved by clean water, every outbreak contained by data-driven intervention, every time someone asks, what does the evidence actually show, instead of accepting what everyone else believes. If this story moved you, please like and subscribe. Tell us in the comments where you're watching from.